We have two different sized rooms, so we're just looking.
I want to welcome you to the first ever Southcoast Wellness Collaborative Conference. To let us get started, I'd like to introduce the Commissioner of the Department of Public Health, John Auerbach. It's the Commissioner's support of workplace wellness initiatives that we've asked him to address us this morning. So without anything further, Commissioner Auerbach.
Well, good morning, everyone. It really is a pleasure to be here because I think that this initiative represents not only a priority for the Department of Public Health in terms of the importance of the work on wellness, but it also represents the cutting edge of the workplace wellness initiatives within Massachusetts. And you, I think, through the work of the collaborative, some of the groundbreaking work that's been done at Lytle Lear and Joseph Abood have really shown what can be done in a meaningful way to change the work environment, to encourage wellness. And so thank you for your commitment. A few specific thank yous that I want to offer are to those of you who actively worked in the collaborative, and to Janet for your work as the chair, to the Chambers of Commerce, who have been very supportive, particularly Fall River and New Bedford, and to the employers. And the DPH team has been terrific, as you've heard already. The group of individuals who work in our diabetes prevention and control program, and Patricia Daly is here, has really been spearheaded the work at the employers in Southcoast. And then Maria Betancourt and Lisa Burke in our wellness unit. Maria's here. Maria heads up our wellness initiatives. Have overseen our increasing number of activities in workplaces, as well as a wide array of other prevention activities. And I'm going to go through a few of those. And very relevant to what we're here today for is we have continued to implement and grow our workplace wellness initiative that Maria Betancourt oversees. We have on our website, I hope you've seen it already, our toolkit and a curriculum that can be used by anybody, any employer. This summarizes what we know about what works, and it gives concrete and specific activities that employers of different sizes with different budgets can undertake. This is always a good reminder. It's hard to measure this, but when we looked at data as we were preparing the toolkits, we looked at what were the justifications from a cost perspective from promoting wellness. We know it's good for people's health. We know it's good for morale. But there also are studies that have shown decreases in sick leave, decreases in healthcare costs, workers' compensation going down. So in the short term, it's difficult to measure these in an individual workplace, but there's definitely literature which shows a well-organized workplace wellness initiative can have a good return on investment for an employer. Do everything at the department we can do to support you. Thank you for holding today's conference, and thank you for the ongoing work you do. We look forward to working with you throughout the year.
I'll just give you a little more information about Green Mountain Coffee Roasters. I wanted to really spend time this morning talking about our wellness programs, its connection to our other employee programs, and really talk to you about some of the highlights and challenges that we've experienced. And it's difficult to spend money on things when your business is struggling. But I would also like to tell you that the opposite is true. This is the time when it really is necessary and great to invest in your employees. Wellness programs don't have to be expensive. Typically, we partnered out with our education fair because of our culture. We also do a lot of continuous education, a lot of employee development. So at the same time, we'll have 8 or 10 of the local colleges come so that people can spend time talking about their education, but also their health and wellness. And we believe that our investment in wellness is truly one of the best investments that we make. Thank you.
And loosen up and have some fun for the next half hour. I gave them a whole day. Straight up now, and then before. Other side.
I know it's really exciting, and you're all charged up from your salsa dancing with Alan. That was great. I'm Janet Hathaway. I'm the Director of Occupational Employee Health for Southcoast Hospital Group, and I'm here as the chairperson for the Worksite Wellness Collaborative. And I'm very excited to be a part of this group. We have our own employee wellness program at Southcoast. Our wellness coordinator, Chris Simone, is here, along with 3 other members of our wellness committee. We have 6,000 employees, and we've had the program going for about 4 years, and it's been very, very exciting, and we've made a lot of progress with it, and had our challenges too. So we're excited to be a part not only of the group, but also of this conference today, so that we can get some fresh ideas. We have a cushioning company with more than 2,000 employees, and Lyda Lear, represented, who has 420 employees, Family Service Association, 300 employees, and then Sylvia Group Insurance Agencies, which has 43 employees.
From a manufacturing standpoint, it's always been, let's look at our equipment, let's make sure our equipment doesn't break, let's try and do some prevention on our equipment. How do we now translate that to our people, which certainly costs us a lot more than our equipment does. So a natural outgrowth of our safety process. You can see some of our key objectives: identifying health problems early. We know if we can catch things early on and we can treat things early, it's going to certainly make people more aware of what's going on in their health, give them better opportunities to be well quicker, but also save us money down the road.
Lear seemed to adopt the wellness concept back in about 2007, and initially started out through our CEO, Zia Efkar. He thought wellness was important, and he wanted Lyda Lear to take its first steps into bringing wellness on board to our manufacturing facility.
And last year when we did the employee survey, we had a 9% increase in reported physical activity. We had a 14% increase in report of consuming fruits and vegetables. 81% of our staff said they felt better the second year of the wellness program as compared to the first. And last year when we asked, 94% of our employees believed that the agency cared about their health and wellness. And when you talk about return on investment, sometimes it's not really down to the dollars and cents, but I'm sure you're all well aware of the value of employees feeling that you care about them in terms of recruitment, retention, productivity, and presentation.
There are a lot of resources available to companies through the internet sites. There are also, as we can see from the vendors here, there are a lot of community resources that we can call upon, and through our own workforce initiative, we now have a website where we're starting to list some of those resources for you. So if any of you are sitting in the audience and feeling like it's just too daunting, or you can't set up a wellness team, or you don't have the budget, I would just encourage you to look and to spend a little bit of time to see what is available there.
Look at your registration packet, and if I could just get a show of hands as to who might be interested in attending the DPH Worksite Wellness Kit Workshop. Workshop. So again, enjoy lunch. We'll be back here at 1:30, and we'll end things at about 2:30. Thank you.
This is a start. Change their position, maybe aligning it more correctly.
Some of the major risk factors associated with chronic conditions I mentioned, and what we have here is some data on some of the risk factors. Obesity is sometimes called a risk factor. It's been, people have been trying to make it an actual condition.
Take you really quickly through the model and what the toolkit consists of. This is a toolkit that is publicly available. It's on the website. You can go download this. You can go use this to implement your own program, or to use the references that are in it. It is chock full of references that you can use for all different types of program interventions.